Yes, okay, moving to next item is our 11, receiving the report from our county executive. James, take it away.
Good morning, President Lee, members of the board. One item that I wanted to report on and share with the board that we're working feverishly on, as the board is aware and many of the public, much of the public is aware, late yesterday, the Federal Office of Management and Budget issued a memorandum freezing federal funds. There's considerable uncertainty around the scope of this action. However, based on a 52-page long spreadsheet that OMB has distributed, it appears countless social services programs and many others, things like child welfare, child support, Title IV-E, HUD programs, DOJ grants, Title I for education, Head Start, many programs are all subject to this freeze. Several of our departments have reported that even though the freeze is not supposed to take effect until 5 p.m. Eastern time today, several departments have already reported that they've been locked out of federal payment portals.
Wow.
We are working hard to assess impacts. We're also receiving reports from some programs and service providers that they've received stop notices from the federal government to cease further activity under their contracts and programs, including significant programs that affect social services such as refugee assistance programs here in our county. We will keep the board updated on these impacts. At this time, I've provided direction to agencies and departments of the county to continue programs, services, and contracts as is while we assess the impact. But as the board is well aware, the county is heavily dependent on direct and indirect federal funding for health and social services programs, as well as a variety of other programs. Many departments have a significant portion of their programs and funds dependent on federal sources. We will be very closely monitoring the situation, taking in the information that we have and proceeding accordingly. But the potential scope of impact, even for short freezes on some of this funding, is very significant because, as the board is also aware, we don't have significant cash reserves as an organization. And so pauses of funding also have a significant impact for us. So we will report more as we're able to confirm and validate. The most concerning thing from my perspective is the action that's been taken is patently unconstitutional. Article 1 of the Constitution vests spending power with Congress. In fact, it's the most important power that's vested with Congress. The OMB memo asserts an extraordinary, unprecedented, sweeping exercise of executive authority over federal spending. It's absolutely unprecedented, patently conflicts with Article 1. Unfortunately, it appears that that leaders in Congress, including, for example, the chair of the House Appropriations Committee, have said that they don't have concerns, which is utterly mind-boggling given what we're talking about. Like I said, we'll continue to keep the board updated. We're working to learn more about what's happening. Supposedly the freeze isn't supposed to take effect until 2 o'clock our time today, but like I said, already several departments are seeing that they're locked out of payment portals. So that's what we're working on now, and something that should concern everybody in the entire country. That concludes my report.
Thank you, James, on that unhappy note. And I just want to ask James if there's going to cause cash flow issues because of these emergency or urgent orders coming through. Would you please update the board in the future so we're aware of these implications?
We will. I mean, that's some of a lot of what we need to assess. It's very evolving. So, for example, the OMB memo only exempted Social Security and Medicare. An FAQ came out today saying they're exempting Medicaid, which is, of course, huge for our hospital. But then at a press conference moments ago, the White House press secretary said she didn't know if Medicaid was exempted, even though the FAQ that was distributed earlier in the morning clearly stated Medicaid was exempted. So, as is the case with a unprecedented, hastily done action like this, there's confusion even within the federal government. And of course, one of our concerns is that in addition to the actual scope of what might be intended, which is in and of itself extraordinary, that agencies and departments at the federal level will freeze much more than even that in an abundance of caution, so to speak, on their end as they try to even figure out what they've been told to do. But regardless of whether, for example, Medicaid is or isn't included, even the list of specific grants and other funding streams that are included is sweeping and extraordinary, and even temporary pauses would have a very significant effect. So we will monitor all of this. Like I said, we'll take action accordingly, but everyone in the country needs to recognize what we're talking about here, which is an absolute extraordinary assertion of executive authority to dictate and control federal spending, and is something that should gravely concern all Americans.
Thank you, James. I see Greta, your light's on as well.
Yeah, I was just going to add, there's going to be so many developments on this throughout the day, and consistent with the comment that the county executive just made, I'm seeing the New York Times reporting that notwithstanding the fact that a memo was just issued saying Medicaid would be excluded from this freeze, the New York Times is reporting that the Medicaid portal is down in all 50 states and inaccessible. So consistent with not only the patently unlawful actions directed by the federal administration, just as mentioned, there's also a tremendous amount of chaos, fear, concern, and disruption that's occurring as a result of this action. I think we're going to see that both locally and nationally, and we're also hearing a lot of concerns from our nonprofit partners, from our staff, across departments, just caused purely by the uncertainty and chaos associated with this order. So did just want to flag that. And of course, we'll continue to both monitor updates, including during this board meeting, and be in communication with our staff, but keep both the board members and the public as updated as we possibly can, as we're also trying to make sure we're doing everything we need to do to protect our interests as best as possible.
Thank you, Greta. I see a couple of lights. Vice President Ellenberg, please.
God, this is so somber. So we just approved, the home visitation program, and so are we going to continue to explore that drawdown from Medi-Cal? What do we, whether it's home visitation or any of the other services that Cowling?
Well, I want to distinguish kind of short-term and medium-term, long-term. Short-term, we're trying to assess what's paused, what impact that has on immediate programs and services, including county cash and revenue, and I'm sure every other governmental entity in the country, school districts, others, are going to be making those same assessments. The intention of the OMB memo is to then examine these programs purportedly for compliance with a litany of executive orders, and our working assumption is that the intent is to then modify those programs with conditions or other things to, for example, direct the elimination of DEI activities or environmental activities or other programs that are the subject of all of those series of executive orders, and that those would come out on a program-by-program basis after review. We'll then have to respond to all of those individual items. in terms of the longer term projections of, what happens with CalAIM or other drawdown, that's something that we'll have to assess after Congress moves forward with whatever reconciliation bill is being worked up. The House Republicans have proposed a long litany of cuts to healthcare and social services programs to fund tax cuts. The list is extensive, and most items on that list are county safety net programs and services, primarily in healthcare. And if those kinds of cuts go through Congress, it will, without question, radically transform funding streams, including Medi-Cal. So we'll have to see what that is and what that looks like and return with adjustments accordingly. So that's a long way of saying we do not know. But if anyone's paying attention to what's going on, I think we should all recognize that we're likely to get a number of significant challenges associated with federal funding, in particular healthcare related funding.
The other, well, you know what, I'll leave it for, I'm just gonna give a heads up. I also worry about how this administration is going to utilize some of our recent approvals that we had in November, particularly Prop 36, as I'm seeing that they're really combing through in a way that is significant to safety net services, and then of course villainizing folks. I think we've seen what some of the deportations overall is, they're murderers and rapists and drug lords and whatever, and so I'm just afraid that Prop 36 is going to be utilized in a way that is going to really hurt our brown and black community. But I can also, I don't know if we already have something in place that is taking a look and having a greater analysis of Prop 36 currently.
I can speak briefly to that. We have provided some preliminary information related to the impact of Prop 36 at the Public Safety and Justice Committee. We're planning to provide additional information with the help and support of the Public Defender's Office and the District Attorney's Office, as well as other local law enforcement partners who are currently collecting data on local impacts of Prop 36's implementation. And we'll be happy to, in addition to bringing that to Public Safety and Justice, provide additional information to the full board on impacts of Prop 36.
Thank you. Thank you.
Yes, Supervisor Ellenberg.
Hearing and not fully understanding what it means to say that the Medicaid portals are down in all 50 states, I want to know what we are messaging to our community members. Does this mean that if somebody has Medi-Cal insurance and they go to a hospital or a doctor right now, that insurance is not valid? Or hopefully that's incorrect. But what are we telling? What is our message to the public right now?
Right now, our message to the public is that people should continue to access programs and services as normal.
They will not be turned away if they are Medi-Cal recipients.
They will not be turned away.
And how does this factor into the pending purchase of Regional Medical Center, which of course is highly dependent? I mean, the design of and the structure of our purchase absolutely contemplates not only Medi-Cal reimbursement, but reimbursement at the higher supplemental level.
We do not know, and we will not be in a position to know for quite some time.
Specifically, we're not going to know before we purchase the hospital.
That's correct. And we have a signed purchase agreement, so the purchase is moving forward. We actually had Virtually 100% of regional employees submit their job applications
Fantastic.
last week, and things are moving along smoothly on that front, and we'll continue to move forward. Any assessment that we'll have to make in light of changes to Medicaid will be holistic and would have to occur regardless.
Right. And I would like to encourage you, James, to use whatever county channels are appropriate to message the fact that residents with Medi-Cal should still continue to use all of our county facilities and that they will not be turned away. There's still going to be a fear. There's a fear that if we're wrong, they will then be billed for whatever the services are. So this is really tremendously destabilizing for a lot of our population, and I'm not confident that we can message in a way that is reassuring, but we absolutely have to be very intentional. And I would certainly think through all of our offices too, we would be echoing whatever the county is putting out.
I think without question, one of the specific intents behind these actions is to be destabilizing. One of the challenges we have, of course, we can clearly message that people will not be turned away from any county services. That's true for folks who are currently uninsured too, right? Whether you have Medi-Cal or don't have Medi-Cal. And that will remain the case. What we can't clearly communicate is the exact scope and impact of what this will have on the county and on our ability to provide services. And that's because we can't even get clear answers, as we've shared, for example, regarding federal Medicaid. And we know that states and many, many other entities across the country are similarly situated and trying to figure out what's going on. But what people do know is when they're logging into certain federal portals to draw down federal funds, they're locked out. And if they continue to be locked out, that has obviously a significant cash flow impact on the state and on us and on many others. So we'll keep the board updated, but this is deliberate chaos. It's, like I said, patently unconstitutional and is an effort to weaponize federal funding in a truly extraordinary way that, of course, harms not just those most in need, which it does, but these are programs that touch every single American.
Yes, Supervisor.
I'm going to try to share my comments without being extremely upset or having my feelings get the better of me. But approximately 60% of our county funding comes from state and federal resources and sources. From the time that this meeting started this morning to this presentation, Medicaid portals and other payment portals have already shut down across all 50 states. We, the board and the administration, are squaring off with a federal administration that is determined to destroy this country. And this executive order has not even taken effect yet officially. At 2 p.m. when this order takes effect, is there a possibility for us to be on the verge of a financial cliff?
Not immediately. You know, we obviously do have cash on hand in the sense that as all the time, right, money coming in and going out in the county organization. And we will closely monitor that situation. A lot of the money that we receive that's federal is received via the state. And a lot of it is payment in arrears. And so some significant portion of funding, the state already has federal funding in hand, but hasn't yet passed on to us. So these are all interrelationships that we will have to monitor very closely. But nothing imminent will happen to the county organization at 5 p.m. today. However, if pauses on these federal funding streams continue for even a matter of weeks, not talking months, I'm talking weeks, then we will be in a different situation. So nothing will happen today, nothing will happen tomorrow, but we have to monitor the situation very closely because we don't have significant working capital reserves, and so in a matter of weeks, if there's a significant cutoff in funding, we will have significant impacts.
Presently, in light of these ongoing developments, I ask for your flexibility as the chairperson of this board if there is necessary a need to step away for briefings based on developments happening in real time. Please do so.
Yes, I will. Thank you. Yes,
And the
Supervisor.
board may see me continue to step away as you have this morning to deal with what's going on.
And I just appreciate Supervisor Ellenberg and James, as you have said, you repeated multiple times during this report out that our services do not stop. We are not turning away any of our patients, our clients, any of our vulnerable family members and community members who rely on the county for services.
Yes, Supervisor Bikuga.
Thank you, President, and thank you, County Executive, and I appreciate Supervisor Young. That was my question is, or actually at this point, my request would be to, and I assume you are planning to, but to update us probably on a daily, at least a
Yes.
daily. Update us daily on this. It looks like there's even possibility of pulling back funds that have already been provided. Is that?
Yeah, so there's a number of other actions happening. First, we will, of course, keep the board updated, especially as we get clarity on some of these pieces. Like I said, for example, on Medicaid, we've heard different things over the last several
Yes,
hours,
sounds
and
like they're
once there's
showing.
some clarity on where it lands, that obviously is a huge impact for us. But we will keep the board updated, and we've provided direction to county departments to make sure we're updated on what they're seeing. The separate from kind of withholding new obligations, new disbursements, we do know that there are some programs where the federal government has issued stop orders, basically telling contractors to cease further work under the program because they intend to cancel or discontinue. And that in addition to that there's been direction provided for certain programs to attempt to claw back funding. Those efforts don't appear to be as across the board. They appear to be more specific. And there's a variety of different legal challenges, but of course, funding that we have in hand is funding that we have in hand. And so, in those circumstances, those would be situations where the federal government would need to initiate some affirmative steps to try to claw money back or to, stop further activity. What's concerning about this broad OMB directive is it stops the flow of money out. And that's something that, we don't have control over, right? So they really are different categories of things. We are aware that some contractors, federal contractors, have received stop orders. Not aware at this time of any county departments or programs that have received a stop order.
Thank you. And I know we had the legislative priorities later on today, and I imagine we will have more opportunity to talk then, and some of our priorities are probably going to shift some. So thank you. Thank you for the report.
Thank you. I mean, as we all have learned from school, that Congress supposedly has the power of the purse to decide how to spend money. And what we're looking at here is, to me, is a true executive power of abuse. And And it's breaking what is truly working. It's a self-inflicted injury that's clearly avoidable. And it seems like the left hand doesn't know what the right hand's doing, given the public messages being given. And we certainly will be looking very carefully on what we can do to absolutely protect everybody in this county. And we're not going to raise fear for folks while we deal with voice issues. And potentially there might be other interventions, maybe judicial, whatnot, that would come along to hopefully we could stop this type of self-inflicted injury moving forward. Okay, thank you. Thank you, James. Yes, Tony, go ahead.
Before I get into the closed session report, I'll just say in reference to the prior discussion that the county counsel's office is sprinting to understand the impacts of this and understand what legal recourse we have. We're in conversation with a number of partners. Just during this discussion, news broke that 23 attorney generals filed a lawsuit seeking a temporary restraining order against this memo, which issued yesterday. There's also a temporary restraining order filed earlier in the day by the American Public Health Association. So I think we're going to see a lot of legal activity around a memorandum and executive action that, as the county executive said, is plainly unlawful and unconstitutional. James, did you want to chime in with something
I'll
else?
just add another piece of breaking news. Apparently, Cal OES has said that public assistance and disaster recovery projects are on hold, which is truly absolutely extraordinary given what's going on elsewhere in California. So, like I said, rapidly evolving, but this is really, insanity.